If Bill C-64 passes, Canada's Minister of Health will be negotiating with the provinces on funding to cover the cost of providing some diabetes medications and contraceptives at no cost. And the goal is to implement universal single-payer coverage for other medications in the future.
It's an incredibly historic moment. We are delivering free birth control and free diabetes medication and devices for every Canadian everywhere in this country. That's what we rolled out today. This is something we've long fought for. The Democrats have fought for this since our party began. The Liberals promised it for 30 years, but broke that promise every year. And it is no coincidence that it is happening now when we have forced them to do so.
NDP leader Jagmeet Singh spoke with us one-on-one, saying it was a huge victory in getting the government to introduce legislation, Bill C-64, for the first phase of a national Pharmacare health plan.
Is it enough? There are some people who are saying it's 2 items, diabetes, contraceptives, not what they would have hoped for. They would have wanted more. What are your thoughts on that?
Well, this is far and above what we had actually written down on paper. What we had forced the government to agree to was just initially the legal framework, so just passing a law. What we got instead is not just a law, but 2 concrete medication classes covered.
Minister of Health Mark Holland spoke about the reason they chose contraception.
Sexual health is health. There are more than 9 million women of reproductive age in Canada. That's nearly a quarter of the population.
Dr. Amanda Black, president of the Society of Obstetricians and Gynecologists of Canada, says they're pleased with the amount of options that will be covered.
The contraceptives that they're planning to cover would include contraceptive pills, contraceptive rings, injectable contraceptives, implants, IUDs, and the morning after pill.
Not all provinces are on board. Alberta and Quebec say they want to control their own programs. As for Ontario, Minister of Health Sylvia Jones had this to say.
Had a very brief conversation with the federal minister a couple of nights ago, but we need the details. So as you know, we have OHIP Plus, we have a pretty robust system, particularly on the diabetes side, with the assistive devices program. So we need to see and assess what the federal government is proposing and how it matches, conflicts, works with the Ontario system that is already here.
The federal Liberals did not commit to a specific cost, except to say it would start at the $1.5 billion range, and it's not in this year's budget.
We have to get through royal assent. We have to get through the process in the House. We have to, negotiate with the provinces. So that's going to take some period of time.
In addition to the initial list of drugs, Bill C-64 lays out several next steps and deadlines to move the government forward with a bigger Pharmacare plan. Back to you.